Welcome to Gutsy Talks. I'm Rachel Larsson, your host, naturopath, and nutritionist, and I'm here to have real, honest conversations that can help you heal your gut, calm your mind, and fall back in love with food. Together with leading health experts, we'll dive into all things gut health and explore the deep connections between your gut and overall well-being, so you can feel empowered to take control of your health and live your best life. If you love all things gut health, follow me for more on Instagram at rachel.larson or head to rachellarson.com.au. Now, let's get into today's episode. Today, we're having a pretty fun chat about an issue that affects us all, and it is pooing. Going to the toilet, passing a bowel motion, however you refer to it, we are all doing it. And what gets me is that there is still such caginess and still such, embarrassment when it comes to talking about poo. Now, I don't expect it to be replacing the question, how are you? And I don't expect for you to be asking your accountant or your neighbor that you see twice a year, how's your poo going or are you pooing? But we do need to normalize it because from what I've seen in clinic, there is a ton of people that aren't talking about it and are experiencing, differences in their stools, which they don't know any different that aren't normal, but are not normal at all. And it is because we're too embarrassed to talk about it that people could go for months or years without knowing that what's actually happening to their body is probably something that they need to look into and giving us a clue that something's not right. And that is exactly what poo is. Not only is it one of our biggest detoxification processes that our body goes through. So if anyone talks about detoxing, if you're pooing every day, and we'll get onto what the ideal poo is and what's not normal, but if you're not pooing, you're not detoxing. So it doesn't need to be this fancy kind of sauna therapy, red light, enemas, juices, although I know that there are places for different things. Just pooing is doing a great job at detoxing. So we need to definitely have that as it's one of our important roles. But the other thing that it is telling us is it's giving us inside information on our insides. It is the stuff that, starts off as food that we consume and passes through our digestive system and comes out the other end. And it's amazing when you understand what your poo means, what that can tell us about our inside. And that's what I'm wanting to share with you today. So if you're not doing it already, you should be looking at your poo. When you stand up, have a quick glance. If you're not looking at it, and I know it's not pleasant and I know it's not beautiful, but it is really important information that for some people, and I don't mean this to be dramatic, but it can save your life because there are markers in there that we can potentially indicate pretty serious things that you'd be wanting to get investigated. And if you're just flushing without ever having a look, you're missing out on that opportunity. So I want to be talking about today the consistency, the frequency, the color, any other kind of, I say weird signs and symptoms, but just, features of poo that you might be wondering, I wonder what that means. Now, there are so many things that we can talk about, and I'm sure if I've missed some, I'll probably get an Instagram message with, hey, Rach, you didn't cover this. What does this mean? I'm going to do my best to cover it all, but I do want you to be listening to this and thinking about this in terms of next time you check your poo, how does that compare to what you've just learnt? And if you're someone who you're on a poo-friendly basis with, send them this episode because they may find, wow, I didn't know that feature that I'm looking at every day is a sign that I've got inflammation in the gut, or maybe I've actually got an upper gastrointestinal bleed, or maybe I've got an issue with fat malabsorption. These are the things that our poo can start to indicate. So let's get into it. Now, the first thing I want us to be talking about is the consistency of our stool. Now, the best and the easiest way to talk about this is using the Bristol Stool Chart, which you need to Google it and you need to probably have a printout, keep it on your phone as a saved image because it's something you can refer to and it makes explaining your poo not only to a practitioner, but even just keeping track of yourself, how are you tracking? Super simple. It was developed in 1997 as a clinical assessment tool to help, assess stools. And there are 7 types of stools, also known as feces, according to the Bristol Stool Chart. So type 1 is where we've got these rabbit-like pellets. They are separate hard lumps like nuts, like Maltesers, like rocks. So like they're hard and separated. They are hard to pass, right? You would expect that. If it's a hard, dried stool in little clumps, it's hard to pass. So number two is where we kind of have those kind of rocks and those clumps, you can still, I guess, see them. It's a bit lumpy, but it's in a sausage-shaped stool, but it's just very lumpy. And again, if you were to look at this, you would know exactly what I'm trying to describe to you, as I don't have a picture, to show you at the moment. Type 3 is where it's sausage-like, but with a few more cracks on the surface. So not as dry, it's getting a bit more soft, but there's still a few cracks. Type 4 is that smooth, snake-like, sausage-like, soft, stool, which isn't super soft, but it's soft enough where you're not straining and you don't see those cracks, which can indicate dryness. Type 5 is where you then actually start to go the other end, where you start to get soft blobs, but with clear-cut edges. So it starts to have the stool not be that sausage-shaped formation anymore, starts to get a bit more blobby. Type 6 is where you've got then those fluffy pieces with ragged edges and it's a bit more mushy. So again, it's not doesn't have that nice formation that we want. And type 7 is watery, no solid pieces. It's pretty much entirely liquid. So 1 through to 7 is describing, I guess, on a scale of constipation being those first two types. That ideal stool type is around that 3 to 4, and more earing towards that diarrhea side is type 5, 6, and 7. Now, that's important for you to be thinking about because it then brings us to, okay, well, if I'm not tracking in the middle, number 3 or 4, what could be going on? So it starts to tell you that maybe there's an issue with diarrhea. And diarrhea is obviously where we've got that could be watery stools, increased bowel motion frequency with urgency. And look, obviously, if there's an infection involved, there may be fever, chills, signs of infection involved, but not always. You can certainly have diarrhea without having an infection component. So technically, diarrhea is having three or more loose or liquid stools in one day. It's a symptom on its own. It's not a medical condition. So that's really important because it's telling us that there's an underlying medical condition that we need to figure out. And, as I said, Bristol Stool Chart of about 5 to 7. So there are different classifications of diarrhea where it is four, I should say. It's osmotic, where you've with the components of the food that you eat, they stay in your intestines for too long and the water can't be absorbed properly. And this excess water, so it's more about this having this water load causes you to have a bowel motion. There can be secretory, where there's increased electrolyte and water secretion from your bowels or into your bowels, which again causes diarrhea. It can be exudative, where there's a loss of fluid or protein from intestinal mucosa, and this can be more associated with damage to that mucosa as well. And then there's motility disorders, which can alter the transit time. So there's four technical subcategories of diarrhea. You don't need to know this right now. That is what will and should need to be worked out. But there's like different reasons for that, and then of those four subtypes, there's different conditions or issues that we need to be looking at, which could be driving that classification or type. So when we're talking about what causes diarrhea, there's acute. So there's acute diarrhea, which we're talking about an infection. You could be having an inflammatory bowel disease flare, for example. You could be having a short-term side effect from a medication, food poisoning, those types of things. Chronic is when, you could be looking at food intolerances, SIBO. You could still be looking at as an inflammatory bowel disease, such as Crohn's or ulcerative colitis, but not necessarily in a flare, but that could still just be your dominant stool type as a result of having that, food allergies, and even chronic constipation. So that's kind of where you can't always tell what is actually happening inside, although it's most likely when you've got diarrhea, just given that the percentage of these aren't constipation, that you may have something else going on, but you can still have constipation and experience diarrhea, which is just a bit of a head trick, right? So just keep that in mind. Now, constipation, on the other hand, is also a symptom rather than a disease. But it's super common. In fact, 1 in 4 Aussies experience constipation. So 25% of us experience constipation. And it's more estimated that about 16 people, or adults, I should say, worldwide have constipation. So Australia is tracking a little bit higher than the worldwide estimation. You could probably put that down to a lot of things. I mean, you could speculate maybe the lower fiber diet that many of us are getting. We're not reaching our fiber quota. While we are known as an active country, there is still a large percentage of us that, may not be active enough to kind of help that process. And then there can be these other issues, these underlying causes for constipation that we've got more of, which we'll get into. So I guess it's a super common thing. Now, I want to talk about constipation because I've had patients who have realized that they finally have constipation, but they had spoken to me about how they had been constipated for what they can now reflect on since forever. So their whole life they've been constipated, but they didn't know that they were constipated until they were mid-20s, for example, or even 30. So they were experiencing maybe 1 to 2 bowel motions a week, at the most. And they thought that that was normal. And it was because that they weren't talking to anybody about bowel motions and doing a poo that no one was there to be like, oh, that's not that much. I go every day. Like there just wasn't those conversations to help that process of maybe there is something going on here. So they experience a weekly 1 bowel motion a week for the first 25, 30 years of their life. That's not good, right? We want to be having these conversations to, have that awareness to support intervention and just kind of understand what's going on and what's causing that a lot sooner. Now, when we're talking about constipation, the Rome 4 criteria is technically how it's diagnosed. And this criteria needs to be fulfilled within the last 3 months of symptom onset or at least 6 months prior to a diagnosis. So it needs to be, I guess, within a time frame, and you need to have two or more of the following. You need to have straining during more than 25% of the defecation, lumpy or hard stools, that's the Bristol Stool Chart type 1 or 2, again, more than 25% of your defecations, a sense of incomplete evacuation, that sense of like you've gone, you're like, there's something still there. In again, more than 25% of your defecations. There could be a sensation of like an anorectal blockage or obstruction in more than 25% of your defecations. You need to maybe manually maneuver to facilitate a defecation. So this could be like literally like digital, like your finger needing to support, or support the pelvic floor in different ways to actually have a bowel motion. So again, that's considered constipation or a sign of constipation. Fewer than 3 separate bowel motions per week. Loose stools, I should say, are probably rarely present without the use of laxatives. That's something else that we need to look at. And, maybe that you don't have that IBS diagnosis due to insufficient, they didn't meet the criteria. So you might still clearly have constipation, but not IBS, which is something that you can have. You can have constipation free of IBS, and this is where you can still be diagnosed with constipation. So if you're probably thinking about that, if you're looking at yourself thinking, do I strain? Do I have a sense of incomplete evacuation? Do I have the hard lumpy stools? Do I have a feeling of obstruction? Do I need to help myself facilitate that bowel motion? Like, you could even be thinking, oh my gosh, maybe I am erring on that side of constipation. Now, there are 3 types of causes. Sorry, I should say there are 2 types with 3 subtypes in the first. So the first type is primary, the second type is secondary. So primary is divided into 3 subtypes. There is slow transit constipation, where there is less than 3 bowel motions per week. There's typically no urge to go, nothing is moving. There is fecal evacuation disorder, or also known as dysenergic defecation. And this is the consequence of the inability to coordinate the contractions of these muscles in that anorectal area. And it leads to this like ineffective bowel motion evacuation. And then there's normal transit time, which then could be of a functional nature where you do have IBS-C, irritable bowel syndrome, with a constipation predisposition or dominance. The second type of cause is secondary, and secondary constipation is constipation that occurs as a result of an underlying health issue or side effects of a medication. Diabetes, SIBO, opioid use, hypothyroidism. This is where constipation comes as a result of the presence of these other things in place. So primary and secondary are your causes of constipation. Now, This is where you can need assistance and understanding. Is it like, do I have any of these other issues? Sometimes that's not always clear. Or am I taking, or have, you might know that you're taking a medication and you're like, yeah, I got constipated when I took X, Y, Z. But potentially there's other issues like there is underdiagnosed hypothyroidism. Like that's a huge issue, which my podcast with Tara Nelson, we speak about hypothyroidism. Like this is a big issue. SIBO, also highly underdiagnosed and under-recognized. So there absolutely could be these issues that are adding to your constipation. You could have the primary type as well, and that can, again, take a bit of investigation to understand. Now, something I wanted to share with you as a fun at-home test, because that obviously makes sense. Poo, testing, fun, of course. But it really is actually a fun test because I've done it. I get my patients to do it. If my patients have a partner or families, they're all doing it as well. What it is a bit of a transit time test. Now, you may have heard of this as a beetroot test or a sesame seed test or a corn test or just a transit time test. And you may have never heard of it. But this is a test that I get my patients to do to see how long it takes their food to then get through their body and be evacuated in the toilet. Now, what we're aiming for is a transit time from mouth to anus for about 12 to 24 hours. Any less than that, things are moving through too quickly. Any later than that, potentially, again, it's a sign of a bit of constipation. Maybe there's a motility issue. There's something that's maybe like, okay, there's a slowness in the gut that we might need to be needing to help speed up or understand its causes. What we do is we get around half a cup to even a cup of corn, or you get about 2 tablespoons of sesame seeds, either or. You consume it, you take note of the time that you did that, and then there's the waiting game. You start then looking at your poo to see when you start to see signs of corn or signs of sesame seeds in your bowel motion. Now, these foods aren't broken down, which is why they come through intact. And that's like a marker for telling us, all right, well, I took it at 11:30 a.m. and then I saw it the next morning at 9 a.m. So that's just under a 24-hour time. Now, when you're doing this, please be aware that you can get multiple evacuations. So you might have your first sighting at 9 a.m. You might get one at 2 p.m. that day, and even the following day, you might get another one. So keep looking out for it until you've seen no more of it. Also, hot tip, don't eat the corn or the sesame seeds in any other meal until you have completed this test. Otherwise, you'll just be thinking that your pooing takes months, weeks. You just give yourself the right circumstances to test as accurate as you can. But it's a really interesting guideline, which I get people to redo throughout their gut healing journey just to get a bit of I go, oh, look, like, how is your transit time going? Have we made any improvements in that? And again, it's like essentially free. You're just paying for the cost of the corn or the sesame seed. So please do that. And yeah, aim for that 12 to 24-hour mark and look out for those other bowel motions if you get more than one. Moving on to color. So it's funny when I ask my patients color, I feel like I need to be in a paint shop and like looking at a wall of paint and like they can be like, oh, it's like moss green or it's like oak brown or it's like just, all the different colors, and this the paint swatches. I'm not great. I've forgotten the name of it, but you know what I'm talking about. There's like so many colors. Now, I don't get into like the nitty gritty. Like I don't need the exact if it's like again an oak brown or a gumtree brown or like I don't know what they call it, a chocolate brown. But there are some terms that we use a lot. So things like we're using chocolate brown, as a good example versus light brown, those are the types of terms that we can be using. Obviously, we want brown to be the color. We want it to be like a nice dark brown. That is the goal. But if you do have a stool that is green, for example, or even, and it may not be like the Grinch green, not like you've eaten the green highlighter, but there can be like a bit of a tinge of green. Now, it can mean that maybe the food is moving through your intestine too quickly. There may be a case of diarrhea there, and that kind of results in the food not necessarily having enough time to break down properly. You could just have a diet that is like so full of greens, like you've got green juices and green this and green that, that like there will be a sense of pigment coming through. But generally, when I see a green stool, I'm probably thinking more about that it hasn't had time to really digest and break down properly. And obviously, any sort of like green pigmented food could have an influence on this. If you see light colored, white, or clay colored stools, there can often be a case of a lack of bile in the stool. So, bile is a very important product that our liver makes, our gallbladder produces and puts out into our small intestine in response to fats. It can indicate that there's an issue happening in that area, such as like a bile duct blockage. You may not have a gallbladder, and there can be other reasons for that, I guess, that fat malabsorption or bile issue. So, certain medications, antacids can do this. Conditions of, I said, that hepatobiliary system can be indicated as well. So light colored stools, clay colored stools, not what we're looking for. It can be a bit of a bile thing. Yellow, greasy, foul smelling, not a fun thing to look at, but if it's there, you sure as hell want to be looking at it just to be like, what is going on? This can be that there's excess fat in the stool. So it can be also an indication of a malabsorption issue. For example, celiac disease. You can have a one-off bowel motion like this if you've gone out and you've had deep fried chicken, you've had hot chips, like you've just eaten heaps of fat, you can have a kind of a one-off situation where your body's like, that was too much, and it doesn't matter how efficient and healthy my gut is, that was just an insane amount of fat to deal with. There can be ones-offs of those, but if you're like, no, this is happening a bit more often than that, and also I'm not having an obscene amount of fat in my diet, like you might be having, salmon and avocado and those types of things in your diet and still be getting this. This is where you're looking at maybe there's a fat malabsorption issue. Black is where it can indicate bleeding in the upper gastrointestinal tract, such as the stomach. Very serious. If you see a black stool, it is something where you're like, I probably need to chat to my GP about this. Please also just keep in mind that if you're taking iron supplements, if you're taking bismuth subsalicate products, or if you've had black licorice, there is going to be a pigment transfer from those. So if you're like, oh, I am taking iron supplements, or yes, I had chocolate bullets with heaps of black licorice in it, and I've got a black stool, that may not need to be a raise the alarm situation. Bright red stools, and that doesn't mean like it is all red. There can be parts of it or around. There still could be like a brown stool with red, in and amongst it, is indicating that there's bleeding in the lower intestinal tract, such as the large intestine from the rectum, and like quite far down, closer to the exit. So, this could be a case of hemorrhoids or something like that. Sometimes, I guess, food can influence this to a degree. Like beetroot, for example, you can have that red pigment coming through, but there is a bit of a difference between a red pigment from a beetroot and that really bright red crimson blood that you would get from having seen actual blood. So there are some things that you're looking out for if you're seeing any of those colors to start thinking about, righto, well, what's this telling me about my internal world? If you see vegetable matter in your stool, such as tomato skins, spinach, zucchini. We've spoken about how things like corn and sesame seeds will make it through intact because of just they're not really broken down. But if you're seeing vegetables and fruits and other like proteins in your stool, this is not okay. Like we shouldn't be seeing food segments and food products in our stools. There can be so many causes of this. It can be that diarrhea process where there's just getting whooshed through the system without time to break it down. But there can be issues with stomach acid, enzymes, not chewing your food, that are contributing to that. So seeing food in your stool is a sign that there is some sort of insufficiency happening in a digestive perspective. Or if you've got diarrhea, you are probably seeing that, there's just not enough time to digest those foods. Also, that diarrhea should probably be addressed because that's not okay in the long term to have all this food that you're eating and you're actually not reaping those nutritional rewards from it. Mucus in your stool. So this is something which I've asked my patients this and like, what do you mean mucus? So mucus, think of it like snot. It is like a jelly-like substance. And the reason why we can see it in our stools is because it lines our intestines. It helps. It's a place that some bacteria love to live. So it's literally their home. It's to help keep our colon nice and moist and to help with lubrication. Now, if you see a little bit of mucus in your stool, really that's not much to worry about because if a stool's passing through, there might be a bit of mucus that just kind of jumps on board and comes on out. So small amounts are fine. But if you start to see, like, if you look down and you see that there's your stool and then there's like, if you see big amounts of mucus, and some people are even having bowel motions that are purely just mucus, it feels like it's a bowel motion, but it's just mucus. This is not okay. This can indicate that there is a lot of inflammation there. It can be associated with diarrhea, intestinal infections. It can be, indicative of a more serious condition such as ulcerative colitis, Crohn's disease, and even cancer. So, like, we're talking about these bits of mucus that you're like, I've got lots of mucus. I might be wiping mucus. And you will know just by looking at it what is okay and what's not. And if you're not sure, talk to your GP. Like, you're better to be told, oh no, that's totally normal, versus you just assuming that it is normal and then going on and you're actually like, oh my goodness, I've had all this mucus for all these years and I never took note of it properly. But there is a big difference between a little bit of mucus, meaning that you know that it's mostly stool there, versus a significant amount where you start to see clumps of it and it coming out on its own. So it is a red flag thing to kind of bring up. We've spoken on blood in stool in terms of the colors, but I just wanted to come back to this point a bit more because it's something that it is not okay to see blood in your stool at any point, really. Like, it is always a red flag. Red flag meaning, no pun intended, the fact we're talking about blood, but a red flag is something which, as a practitioner, I have to tell my patient and even write a referral letter that my patient is seeing blood in their stool. We need to investigate this. We've spoken about how the different colors can indicate where it's coming from. So when you've got the like the darker, like the black in your stools, you may be looking at bleeding happening far higher up in your gut, such as your stomach. So you might be looking at a stomach ulcer, or even as an unfortunate side effect is warfarin, which you need to be thinking of. Now, you can have dark stools, like we've mentioned, from iron tablets, or if you eat a lot of like licorice and blueberries. So again, like if you're eating a lot of those things or taking that, take this, what I'm telling you, with a bit of a grain of salt, that it might just be that. But if you're like, I don't eat those things and I'm not taking iron tablets and I'm having really dark to black stools, please reach out to your GP. You can have more of a darker blood, again, suggesting something slightly higher up, maybe not stomach, but could be higher up in the small intestine. And then things that are bright red are going to be closer towards your colon, towards your rectum. This can be an inflammatory bowel disease, diverticulitis when it's flared, hemorrhoids, anal fissures, things like that, even bowel cancer. So again, we just need to get the all clear from a doctor, if you're seeing these signs, because we don't want to play around with these. So when we're talking about all of these issues, I know that especially when we're talking about, like, how do we treat, especially if we're talking about constipation or diarrhea, oh, I just take Osmolax, I just take magnesium, or I just take GastroStop. Look, while that could be helpful, especially if it's impacting your quality of life, it is still just a symptom management, and there's often underlying conditions that need to be identified. Poo is a sign, it's a symptom of, and is a great indicator of larger workings of our intestinal tract. So we want to be actually listening to what it's trying to tell us. So just be careful if you find yourself stuck on a medication or a supplement to help with your bowel motions, that if you're not looking at that issue any further, that maybe you should. If you're using them because it's appropriate for where you're at right now, fine. But there is a fine line between being stuck on them without looking further and using them as an aid while you're looking at further. Now, I did save the best till last in terms of the sign and symptom, which I think people can find most embarrassing when it comes to their stool, and that's having really floating or sticky stools. That's kind of not what we're looking for. A stool that floats and a stool that leaves lots of skiddies and sticky, not what we're looking for. And that can be really embarrassing to talk about, which is why I'm telling you, you don't need to, you can kind of hear this for yourself in your own, I guess, at your own time. And you don't feel like you have to out yourself to kind of learn a bit more about it. But this floating and sticking types of, features, they can be once again a sign of like fat malabsorption or just malabsorption, but particularly fat malabsorption, and particularly when there is the floating and sticky aspect. When you think about the floating aspect, think about when you mix water and oil together. They don't mix. The oil rises to the top. The same does it when there is fats in the stool and they haven't been broken down, they haven't been emulsified, and they haven't been digested properly through the processes that should be happening in the body, like the bile and the enzymes and all those things. When it comes through as a bit more of a whole oil, it is going to cause your stool to float. So if you've got a floating and sticky stool, again, be maybe looking at that sign of fat malabsorption, or there could be malabsorption issues that could be causing a really quick transit time. And again, nothing's really been absorbed properly. So the ideal poo. We know what to look for if when we're looking at a poo, which that is everyone's homework from here till forever, is, be looking at your poo. You want to be knowing what's going on inside because again, you can have these incredible insights that can be quite early on to the issue, which, if you start paying attention to, can be really useful. Now, you don't have to become obsessed, but just a quick glance is all that you need to do. What we're looking for from an ideal poo perspective is 1 to 3 poos a day. That's kind of really ideal. You want to be doing it daily, but if there is a day or two that you miss here, I'm not too worried about that because constipation, they diagnose it or they consider it to be constipation when it's less than 3 times a week. So you've got a bit of, bit of wiggle room. But I think 3 times a week isn't enough if we are looking at how much food that we're consuming and its important role in detoxification. So 1 to 3 times a day. And that can vary on what you eat, how much you move, and how stressed you are. Stress is a really big influencing factor on this whole poo chat that we're having today. So keep that in mind. You want to be aiming for a Bristol stool chart of 3 or 4. That's the goal. So print out, save a picture of the Bristol stool chart, and just keep an eye. If you're finding that you're nowhere near that on a regular basis, that there's something going on. So the 3 or 4 is more that formed shape. We don't want to see blood, no blood at all. If you do see blood, check it out with your GP. If you do have known hemorrhoids or anal fissures and things like that, you might see blood here and there, but you do need to check with your GP to ensure that's all it is. And if further investigation is warranted. We want to make sure the poo sinks. Again, we want to make sure that that fat has been digested properly so that it's not causing our stool to float and stick to the side of the bowl. We want it to sink. We want it to be brown. Again, you can go to your local paint warehouse and look at all the different colors, but looking just for a chocolate brown. We just want like a nice dark brown, which of course might be influenced if you're having beetroot or if you're having an iron supplement. If you're having lots of greens, you might get a few different hues, but for the most part, that deep brown is a healthy poo. We don't want there to be mucus, not lots of it. You might see a very light coating. And again, like you probably don't, if you're needing to really squint and look at that to find the mucus, you're probably okay. You know what I mean? Like if a little bit of mucus that you're needing to search for is probably a totally normal amount of mucus. So you don't also want to see anything undigested in your stools, except for, a few foods like corn and sesame. You aren't wanting to see last night's carrot, cucumber, spinach, blueberries in there. You're wanting to see all of it digested and just to be, food free. And you do want to have an empty feeling. So, not a sense of incomplete evacuation. We want to be having a bowel motion, standing up and being like, yep, that's all I needed to do, and it's all out of me. So, they are the what are it, 7 or 8 signs that are looking for in an ideal poo in terms of the timing, the consistency, the different features, the color, all those types of things. So I love, again, talking about poo as an indication of something that's going on the inside and as a sign that there's an underlying pathology or dysfunction that we need to be working on. If you want to learn more about understanding, if you're like, well, I've been constipated or I've got diarrhea forever and my GP or my doctor's only telling me to take Osmolax or take GastroStop and that's all that they're doing, and you know there's something more going on, check out Bloated to Body Confident. I'm going to have a limited time 10% off Bloated to Body Confident. There will be the show notes in the detail, but this is the step-by-step process to heal your gut from the root cause in a natural way. It's a 10-step process, which is the strategy that you need to go past that symptom relief and really get to the root cause. But your poo is clearly telling you that there's something that you need a bit of help with. And this is really one thing that you can do to get to the, no pun intended, bottom of that. So check out the show notes. So lastly, please send this to someone who, again, that you're having poo-friendly conversations with that doesn't know this about their poo. It tells us a ton of information. So keep checking your poos. And until next time, keep up the good work and aim for those perfect poos. Thanks for tuning into Gutsy Talks. I hope today's episode left you feeling inspired to take the next step in your gut health journey. If you're ready to dive deeper, head over to rachellarsson.com.au. There's a range of courses and resources waiting for you. If you loved this episode, I'd be so grateful if you shared it with others who might benefit from this information. And so you don't miss out on future Gutsy Talks, be sure to hit follow and leave a review. I'd love to hear your feedback. I'm Rachel Larsson, and I can't wait to connect with you again for our next Gutsy Talk.